You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, we are looking at some of the newest research that is coming down in the oral and subsequent systemic link space. Okay, this research article just published in May of 2023 is exploring the relationships between periodontitis and cancer risk. I actually love this. They have coined this terminology called Anti-Periodontitis Therapy. Do you guys love that? So what they did was they looked at some of the data as we understand it. Specifically in this study, they looked at the risk of prostate cancer in men, and in both men and women, the risk of thyroid cancer. And what they wanted to do was understand what happens when a patient with periodontitis receives, as they call it, anti-periodontitis therapy. Again, I'm like obsessed. You guys are going to hear me start saying that all the time now. Okay, so in this study, they acknowledged, we understand that if a patient has periodontitis, that they do have an elevated risk for cancer. Now, without going into all that we understand about statistical analysis on the p-value and all of those things that we all had to remember when we were taking our national boards exam, without going too far into that, it's important for our science brains to be acknowledged here. When we take a look at data like this, a patient who has periodontitis has an elevated risk for cancer. Our brains are going a mile a minute. We're thinking things like, is it the periodontal pathogens that are causing this issue? Is it the fact that the patient has inflammation? Is it the fact that the patient's immune system is declined? What are the direct causalities that are elevating this risk for cancer? And this is where we're starting to see some of that loosey-goosey verbiage that shows up when you read these research abstracts. Things like, this may lower, it might lower, it could lower, right? You start to see those little like suggestive things because it's really hard for us to say, Porphyromonas gingivalis causes thyroid cancer, just as an example. So we've looked at this data forward and backward when it comes to the presence of oral inflammation. And then, of course, long-term down the road, what that risk would look like from a cancer profile. But one thing that we really have not dove into a lot is what happens if, here it is again, anti-periodontitis therapy happens, right? What happens if we can actually debride these patients? What happens when this patient receives treatment, including subgingival curettage of scaling and root planing, periodontal flap surgery? What happens when the patient receives treatment for periodontitis? Does that in fact rectify or address some of the patient's cancer risk? So again, in this research study, they were specifically looking at the cancers of prostate cancer and thyroid cancer in populations. And when they removed all of the, exclusion factors, things that you need to worry about, like, tobacco habit and, age, race, gender, all of those pieces, we were looking specifically at what, from a primary cancer outcome standpoint, are we seeing on a risk profile? Okay, so here's the data. And you guys, this is amazing. Here's the data. In this research study published in May of 2023, the conclusion was that patients who have periodontitis, who received treatment for their periodontitis, exhibited a lower cancer risk compared to those who did not receive treatment. The findings then suggest that a periodontitis patient who will undergo treatment will have a significantly lower risk of developing cancer compared to those who do not receive treatment for periodontitis. This is important because oftentimes I find that we're so focused on talking to our patients about the risk to benefit ratio when it comes to periodontal therapy. And we're oftentimes having the dialogue with our patients about Well, if we don't move forward with periodontal treatment, it's not a matter of if, but it's a matter of when. You may lose a tooth due to the ramifications of this disease process. And we might get into some of the oral systemic conversation. But this research study gives us some clear language that I think we need to start owning inside of dentistry, and particularly in the hygiene space. And that is, Mr. Jones, data is now suggesting that with your active periodontitis, if you undergo treatment for this active periodontitis, you will experience a significant lowering in overall cancer risk. If you do not receive treatment for periodontitis, your cancer risk, we could theoretically see increase. And I don't normally do this, but in our posting here, you will see that research article. If you have time in between patients, whoever has time in between patients. But if you do have time in between patients, I encourage you to scroll down, check out the article and scroll down to figure 1. This visualization gives you information on follow-up time and comparison cohorts, and more specifically in figure 2. If you take a look at these charts, you will see the difference between a risk profile of a patient who has perio and has received treatment and how low that risk profile is compared with a periodontitis patient who has not received treatment. And you will immediately see a diagonal line scribbling right across the top of that chart, going from the lower left corner all the way up to that upper right corner. You see a steep incline if a patient has periodontitis and they do not receive treatment versus that kind of lower, lazy, semi-horizontal line that you see when a patient has received treatment. This dynamically different dichotomous data tells us that the work that we do as oral healthcare practitioners isn't just about saving one tooth at a time. It is now about helping render our patients healthier. The findings inside of this research study suggest that periodontitis could theoretically be considered a modifiable risk factor for cancer. I'll say that again. Periodontitis could be considered a modifiable risk factor for cancer. In that, effective treatment for periodontitis could potentially reduce the risk compared to individuals who, for example, have not received periodontal therapy. This study provides evidence supporting the notion that the treatment of periodontitis extends well beyond oral hygiene benefits and may have extremely profound implications for cancer prevention. Okay, let's think about what this looks like when it comes to our patients. Are you currently asking your patients if there is any cancer risk, whether that be perhaps conversations that are happening with our medical colleagues where perhaps some of these individuals are being actively monitored for fast-growing cells? Maybe they have some of those risk factors in the past that their OBGYN, their proctologist, gastroenterologist, their rheumatologist, their cardiologist, some ologist is stating, we are actively monitoring you for cancer risk. Or gosh, the lowest hanging fruit here is, do you have a family history of cancer? Because a patient who has a family history of cancer, we understand that these individuals will also experience an elevated risk of experiencing similar cancers. So now this changes the dynamic. If a patient has a family history of cancer or they are being actively monitored because of suspicious cells, and now we detect active periodontitis in these patients, the findings of this research study indicate that if we can perform anti-periodontitis therapy, that we have the potential ability to reduce the risk of this patient experiencing cancer. And long-term, our therapies could have implications in overall cancer prevention. I've never been more proud of our profession and the incredible data that is validating the delicate work that we do. This has been another episode of Fast Facts, Perio edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.